All right, today we're going to dive into a topic that's really picking up steam in the world of oncology. And honestly, it carries just an incredible message of hope and, well, empowerment. We are talking about the brand new evidence that connects exercise directly to cancer care.
For the longest time, the answer to this question seemed super obvious, right? If you're fighting a disease like cancer, your body needs to rest. But what if that's not the whole story? What if being active could actually be a powerful part of the fight? That's the big question we're going to tackle.
So yeah, let's start with this idea, which, let's be honest, is pretty counterintuitive. It really challenges some of the oldest advice that's been given out about cancer recovery. And it totally makes sense, doesn't it? When you're going through treatments that can be absolutely draining, the idea of saving every single ounce of energy feels like the most logical thing in the world to do. And for a very, very long time, that was the standard advice. But that old story, well, it's starting to get a major rewrite. There's this compelling and growing body of research that's pointing us down a whole different path, one where structured, thoughtful movement actually plays a key role.
And look, this new story, it isn't based on anecdotes or just wishful thinking. Not at all. It is built on hard data. So, in this section, let's really look at the survival evidence that's causing this huge shift in thinking.
Okay, before we go any further, it's really important we all understand this term, overall survival. In cancer research, this is a huge deal. It's a critical metric. We're not just talking about quality of life here. This is the gold standard for measuring how long patients live after they've been diagnosed. And this is the headline, the big takeaway. Across multiple, credible studies, structured exercise is being linked to significant, totally measurable improvements in overall survival for many patients. And we're not talking about a small effect here. We're talking about a really powerful one. And get this evidence isn't coming from some obscure corner of the internet. It's being published in the world's most respected medical journals. We're talking heavy hitters like the New England Journal of Medicine and the Journal of the National Cancer Institute. Now, when findings show up in places like these, it signals a major shift. What these studies are finding is that exercise might actually change the body's internal environment. It could potentially reduce inflammation, boost the immune system's ability to fight cancer, and maybe even help treatments work better. It's a whole new way of looking at things.
So, when we use this term structured exercise, what do we actually mean? What does it look like in real life? This next section is all about making this idea feel a lot more accessible and, real.
I think this quote from the research just says it all. Modest and achievable. This is key. This isn't about pushing people to their absolute limits. It's about finding a level of activity that's realistic and something you can actually stick with.
And just to be crystal clear, the first image that might pop into your head is some elite athlete, right? But that's not what this is about. We are absolutely not talking about trying to train for a marathon while you're going through treatment.
So, what are we talking about? Something as simple and as powerful as this. The type of activity that showed these incredible benefits often boiled down to just 3 or 4 brisk walks a week. That's it. It's all about consistency, not some crazy intensity.
Now, this evidence is so exciting, but, and this is a big but, how you act on it is what really matters. And any action you take has to begin with a crucial conversation.
So let me be absolutely 100% clear. The information we've just gone over, this is not medical advice. Every single person's situation is unique, their diagnosis, their treatment plan, everything.
The real purpose of sharing all this with you is to give you a powerful conversation starter. It's about arming you with the latest information so you can have a really proactive discussion with your healthcare team. The goal here is pretty simple, really. It's to help you actively engage with your oncologist about what might be right for you. It's about exploring if you can add some complementary care, like a safe exercise plan, right alongside your main medical treatment, but only if it's appropriate for you.
And look, if you take only one single thing away from our chat today, please let it be this. Any decision about exercise during cancer treatment is, with zero exceptions, always a topic for a very close and ongoing discussion with your oncologist. They are your partner and your guide through this entire process. So, as we wrap things up, I just want to leave you with this thought. Armed with this new evidence, and of course in partnership with your doctor, could a simple, modest, achievable step forward, like just taking a walk, turn out to be one of the most powerful steps you take on this journey? It's a question that's definitely worth asking.